Here, Peyton, in our First Alert team, talking about the temperatures. And when you're confronted with dangerously high temperatures and rising humidity, the risk of heat-related illnesses like heat stroke and exhaustion is so high across the Palmetto State.
So we want to think safety first, whether you're headed to summer camp, doing yard work, or just trying to stay active and stay safe out in the heat. It requires a lot more than sunscreen, although we hope you're using that as well. Joining us now is Dr. Susan Jurgen from the USC Arnold School of Public Health with expert advice on how to beat this heat. And Susan, first of all, thank you for coming in. We just heard Peyton talk about how the rain is going to cool us off for a bit, but you know this South Carolina heat, it will be back in no time. And it's not something people should take lightly.
No, so people need to consider that heat-related illnesses can happen quickly, almost as fast as 20 minutes. And we do have very unique heat here in South Carolina. First, we're in the southeast, so our air temperatures are really high, like she just showed. And because of our geography, we have a lot of high humidity, which both impact our body's ability to dissipate heat.
And when you think about the summer, we have a lot of athletic camps happening. Younger people are outside, older people going out for a walk. These groups specifically, what do we need to watch out for when it comes to those age ranges?
Sure, those are great groups to consider in this heat. So elderly, they have blunted or slowed thermoregulatory mechanisms, so we definitely want to be looking out for them. I would say caregivers should consider encouraging them to always have their air conditioning on, but if they don't have air conditioning, they should be encouraged to go find a cooling shelter, or a great time to have hospitality and invite those people over to be in air conditioning. Children, they have good thermoregulatory mechanisms. However, they really depend on dissipating heat through the skin, whereas adults, we usually dissipate heat through sweat. So children should be encouraged to take more breaks more often when they're free playing or in sports. And they should also be really good about their hydration habits. And then you mentioned athletes or even outdoor workers. They're at danger because of the activity that they're doing. So because they're being active, they are generating heat internally and then gaining heat from the environment. So they also need to be taking breaks and being very creative with their cooling strategies.
Listen, I saw a crew out today paving one of the roadways. I wish I had a cooler of water to give them, because I mean, they looked like they were putting in some work and that they were all sweating it out there. I know you've put out these tips, and we've shared them often, saying, you know, when the temperatures rise, to go ahead and adjust your activities, right? Do things earlier in the morning or later in the evening after the heat of the day. And a good rule of thumb for our community, if they are adjusting the training schedule for the troops at Fort Jackson, you should govern yourselves accordingly and do the same. But in addition to adjusting the time of day when you're out in the heat, what about clothing considerations and hydration?
Yeah, those are great points. So people should be wearing clothing that are shorts and short sleeves, that are light colored, like whites or light colors, and should be made of like a material that's very breathable. And then hydration habits, always make sure that you're drinking throughout the day. Nobody needs to chug or drink large amounts, but people should drink things that are like cold or flavored or anything that they enjoy.
Yes, but more specifically about what you're hydrating your body with is so important. There's so many different things on the market that are telling you this is the best thing you need to drink. Outside of water, what else would you advise people to make sure they're staying hydrated with?
Sure, so water is always a great place to start. I'm a big fan of flavored water as well. We know that if it's cold or flavored, people will drink better. In terms of things to avoid, so it is a myth that caffeine will dehydrate you. So as long as it's in low levels, right? So like a cup of coffee or a cup of tea, you want to be careful of those energy drinks that are on the market. They have high levels of caffeine and they can dehydrate you. So that should not be where people are looking to hydrate with.
And what cautions would you offer parents about kids and caffeine?
Yeah, so everything should be just low level in terms of like your typical cup of tea or typical cup of soda. Nothing should be anything beyond that in terms of energy drinks or anything that is marketed to have a high level of caffeine.
And from a medical standpoint, we talk about heat advisories all the time. People hear those words. You live in South Carolina, you may brush it off. But from a medical standpoint, why is it so important to take heed to those advisories?
Yeah, because we need to be very mindful of heat-related illnesses in our state. So heat exhaustion is caused by dehydration, and people can not be able to continue what they were doing, and that is something that definitely deserves care. But what we're really concerned with is heat stroke, right? That's a medical emergency. That's when a person's core body temperature gets really high, and they're going to be acting not themselves. So they're probably going to be answering questions, but they're going to be irrational. Their personality is going to be different. They might be confused. If you start to see those things, you should be very concerned about the person and try to get advanced care for them.
You know what, I want to show the graphic that you pointed us to one more time because it had great tips about treating heat illness and heat exhaustion. And I'm so glad you pointed out about some of those signs and symptoms, Susan, because it made me think back to the Gamecock women's basketball parade after the last championship. It was blazing hot outside, and there were people immediately in our immediate vicinity who just stopped being responsive. And it took people a minute to realize that they were overheated and that they were in distress, and for emergency officials to get in there. So move a person to a cooler place. Cool with cold towels can help as well. Provide drinking water. Call 911. Don't hesitate. It's always best to err on the side of caution and transport them to the hospital if necessary. Susan, great reminders to keep in mind, especially as kids are headed to camp and as we have people out doing the yard work and all of those other things. Check in on your neighbors too. Is always a really good thing to do.
Yes.
All right, Susan, thank you so much, and wishing you a happy and safe and a cool 4th of July.
Thank you.
Thank you so much. We'll be right back, everyone.